Welcome. Thank you all so much for tuning in. Thank you so much for tuning in. I am Dr. Faith B.Yisrael, formerly Faith Brebnor. I am an assemblyman in the Tobago House of Assembly. I also am a health professional, a behavioral and community health sciences health professional. My training officially is in, I have my bachelor's degree is in neuroscience, because at one point I thought I wanted to become a neurosurgeon. Then I got my master's and doctoral degrees in behavioral and community health sciences in public health. If you are hearing me, please say hello so that I know that you are there. I want to make sure everything is good. Hi, good day, Zia. How are you? Thank you so much. Please also share the live as soon as you jump in. Share the live. Thank you so much. Today we would be talking about something that has been a lot of people have been talking about. We have all of these travel restrictions. And now that we have the various COVID-19 vaccines, we are now hearing about which country allows you to come in with which vaccines and all of that stuff. So I wanted to spend just a little time today talking about what really are the rules, because we hear the snippets and we don't really understand what the rules are. And I wanted to talk a little bit about the Trinidad and Tobago rules, because I think it was Saturday, I can't remember when it was, where the Minister of Health, it was the Prime Minister who started talking about it. And then he called the Chief Medical Officer to continue talking about it, to say, well, who can come in where in Trinidad and Tobago. I'm hearing Anne is saying, hearing you good afternoon on the road. Be careful, Anne, be careful. Kelly, you're not hearing me. I wonder why is that the case. Is anyone else hearing or not hearing? Let me know before I go on. I want to make sure that everyone else is hearing me. So I want other people to type. Let me know whether you are hearing me or not. So one, just say, hi, I'm here, and I'm hearing you, or no, I'm not hearing you. Type, let me hear. What's happening? What's happening? So Shanda is hearing. Thank you so much for tuning in. Valerie said hearing. Thank you so much for tuning in. Good. So Nelly, you may need to jump out a little bit and come back into the live, just to make sure that is not something up with your device, whether it's your laptop or your phone. Thank you so much, Carl. Thank you so much and welcome, Michelle. Thank you, Trisha. Thank you, Afia. You all, thank you so much. And do me a favor, everyone. Everyone who comes in, if I could just ask you, please, please, please. I'm going to be talking about the COVID-19 travel restrictions, particularly as it relates to going to the US and Canada and all those places. So please take a second. Please take a second and share the live so that we can have other people tuning in as well. So the place that most of us are most familiar with is the United States. Hi, thank you for joining, Miss Helen. How are you? Thank you for joining. Oh, I haven't forgotten. Actually, I did forget. I am going to, when I get off of this live, I'm going to message you. I'm going to message you. I did forget. I'm so sorry. Thank you, Luan. Thank you, thank you, thank you. I am going to message you, Miss Helen. Sorry about that. I really forgot. I completely forgot. Anyway, so I want to start by looking at the United States. So I want to look at three countries or three areas. We have the United States, we have Canada. I want to look at Europe, UK there, and then I want to come back to Trinidad and Tobago to let you hear what the what the Prime Minister and the CMO said in terms of what our rules are, and we go from there. Thank you, Cheryl Lockton, and very interested. Good. Lois, you said from La Hocata. Okay, cool. How is Trinidad? Tobago is really nice and sunny. Well, no, it's not. It's kind of overcast. It was raining a little bit before. I think I said nice and sunny because it's hot. Yeah, I'm not even sure what's happening with the temperature. So let me start by going with the United States. And to pull up the information about the United States, let me share. I want to use the CDC. I want to use the CDC's. What is that? The CDC's international travel guidelines. So I want to make sure you're all seeing that. Everyone's seeing that. If you're seeing it, let me know that you are. Let me add this to the stream. Yes, it is. So this is from the CDC's website, and we know that the CDC is the Center for Disease Control and Prevention, I think is the official title of CDC. So I did not want you to say that I said anything. I just wanted to make sure that we got exactly what was written by the CDC. Oh, it's sunny there. Cool. So let me go back to this page that I am thinking from. Okay, so as you see, it was last updated 10th of June. And I looked for more recent updates and I haven't found any. If anyone knows of a more recent update that I need to be looking at, let me know. But this update is from the 10th of June. And it basically is telling people, as it says, first line, do not travel internationally until you are fully vaccinated. And let me go there. What does fully vaccinated mean? What does fully vaccinated mean? How do you know you are fully vaccinated? Is it still sharing the stream? Let me make sure. Have you been fully vaccinated? Yes. So according to the United States guidelines, fully vaccinated means 2 weeks after your second dose, if you are taking Pfizer or Moderna. So those are the two-dose vaccines that they are giving in the United States, or 2 dose after you've gotten your single dose for Johnson and Johnson. So we need to recognize that when the United States says fully vaccinated, this is what they mean. You have to have gotten your 2 doses if you are using Pfizer or Moderna, and you would have waited 2 weeks after that. or if you're using Johnson & Johnson, which is a one dose vaccine, then you have to wait 2 weeks after you've gotten your one dose. Okay, so I want you to be clear. When the United States says fully vaccinated, they mean that Pfizer, Moderna, and Johnson & Johnson. That is what they mean. They have recommendations. If you are fully vaccinated, you could go outside, make sure you wear a mask and make sure you are safe. And they're saying before you arrive in the United States, so it means you have come back. Now, granted, the way these things are written, they are really written for the countries that they are talking about. So CDC is writing this as if they're talking to US citizens. Okay, so they're telling US citizens this is what it means to be fully vaccinated. If you leave the United States and come back, this is what you need to do. It also talks about other people. Right. So if you are fully vaccinated, all air passengers coming to the United States, including US citizens and fully vaccinated people. So citizens and fully vaccinated people, meaning people who may not be citizens, but they are fully vaccinated according to US guidelines, which is Pfizer, Moderna, 2 doses, 2 weeks after your second dose, and Johnson & Johnson, 2 weeks after your first dose. You are required to have a negative COVID-19 test no more than 3 days before you travel, or documentation of recovery from COVID-19 in the past 3 months. So let's just say you have COVID-19 and you have recovered. That's fine too. You just need to show them documentation that you have actually, recovered from COVID-19. When you get into the country, granted, remember, this is for fully vaccinated people, you need to get tested with a viral test 2 to 5 days after you've traveled. They are also telling you need to monitor for COVID-19 symptoms, isolate and get tested if you develop symptoms. But they are also saying, because it's important to note that in the United States, it's a federal government, right? It's a federal system. So each state may have different rules. So it's important for you to know that you need to check the state that you are going to make sure the state that you are going to does not have additional rules that you need to follow. Okay? And this is again for citizens and other people who are classified as fully vaccinated. If you are classified as unvaccinated, and this is where it's kind of sticky, unvaccinated means anyone who did not get any vaccine at all. It means anyone who only got one dose of Pfizer and Moderna or Moderna. It also means anyone who even got your 2 doses of another vaccine, if it is not Pfizer, Moderna, or Johnson & Johnson. So if you are from Trinidad and Tobago, where we have had AstraZeneca, you need 2 doses, where we have had Sinopharm, where you need 2 doses, or if you are part of a certain category of people, you may have gotten into the rush to get your Pfizer. Well, if you got into the rush to get your Pfizer and you got your 2 doses, then you're classified as fully vaccinated. But if you are from Trinidad and Tobago and even if you got your full regiment of vaccine, according to the CDC guidelines, you are not classified as fully vaccinated according to the United States. And this is what they are saying you need to do. If you are not fully vaccinated and you must travel, you have to follow these steps. Before you travel, you need to get a viral test, which is a PCR test done 1 to 3 days before your trip. So you have to actually prove that you have a negative PCR test done for COVID-19 1 to 3 days before you travel. It means if you are leaving Trinidad and Tobago to go to the United States, you need to have gotten your COVID-19 test 1 to 3 days before you travel, which means you need to get it from a private lab if you are in Trinidad. If you are in Tobago, you probably need to go to Trinidad a couple days early to get it done in Trinidad. Or I do remember the Division of Health, or maybe it was a TRHA, saying that they were going to help people get samples to Trinidad. So, you make your arrangement with the private lab in Trinidad, and they could have helped you collect the sample and sent it down to the private lab so you don't have to go to Trinidad. I honestly don't know if that is still in place right now. I do not know. And I am not aware of another way of getting COVID-19 tested in Tobago if you have to travel. It's also saying that you need to make sure that you understand whatever are the airline and destination requirements. Make sure, if you need to wear your mask right through, whatever it is. Again, while you are traveling, so this is if you're going out, it's giving you instructions: wear your mask, avoid crowds, wash your hands. Before you arrive in the United States, again, it says all air passengers coming to the United States, including citizens and fully vaccinated people, are required to have a negative test no more than 3 days before their departure. And if you've had COVID, show that you have recovered 3 months. After you've traveled and you are, remember, and you are unvaccinated, you need to get a viral test 3 to 5 days after you've traveled. And you see they put the "and" in bold. You need to stay home and self-quarantine for a full 7 days after you've traveled. So if you do not have Pfizer, Moderna, or Johnson & Johnson fully vaccinated and you go to the United States, you have to get a viral test within the week. So 3 to 5 days after you've gotten there. But they also expect you to home quarantine for 7 days. It says even if you test negative, you still have to home quarantine for 7 days. If you test positive, of course, then you have to go through the process of what you do if you are positive. Self-isolate, make sure you don't get other people infected. And if you are getting really sick, get to a hospital, get to a health facility if you think. If you don't get tested, meaning you can't be tested within the 3 to 5 days after you've gotten to the United States, then you have to self-quarantine for 10 days after you've traveled. Again, avoid being around people for at least 14 days. Make sure you self-monitor so that you don't pick up any COVID-19 symptoms, and you follow whatever your state requirements might be. And this is important, again, because you may go to different states. So Florida may have a different set of rules compared to New York, compared to California, compared to wherever. So depending on where you are going, you need to check your rules, the rules there, to make sure, right? So this in essence is what the CDC is saying about travel to come into Trinidad, to come into the United States. What am I talking? To come into the United States of America. Right? So it is not saying that you can't go to America. It is saying that when you get there, if you are not fully vaccinated, you have to follow the guidelines of getting tested 3 to 5 days after. And if you can't get tested, and even if you're tested 3 to 5 days after, you still have to self-quarantine for 7 days. And if you can't get tested 3 to 5 days after you get there, you have to self-quarantine for 10 days and so forth. So you have to follow the guidelines, and depending on where you are going, you need to follow the guidelines or whatever that state says. So this idea of that you can't travel is actually not true. Now, granted, you still have to, if you have a green card, or well, if you're a citizen or you have a green card, then you travel freely. If you do not have a green card and you don't have thing, it means you have to get your visa and all of that. So that is another hurdle. So if you don't have a visa and the U.S. Embassy in Trinidad is not open, then you can't get your visa to travel. But that is a different thing. That doesn't have anything to do with you being vaccinated or not. That has to do with the country being shut down, the U.S. Embassy having their own rules about when they open and when they are not open, and about whether they are accepting people to come in and get visas and that kind of thing. The other thing you need to be conscious of is that, remember, the rules about travel Remember, the rules about travel have been always. So, for example, if you are traveling to the United States on a B visa, which is a visitor's visa, you cannot get on a plane unless you show them you have your return ticket, right? Now, before the borders were shut down, that is a normal thing. That's a normal thing. You can't get on a plane to go America unless you have your return ticket to show them that you'll be back in 2 months or whatever. Um, the issue with during the lockdown, and particularly when we have restrictions in Trinidad and Tobago to come back, there were people who wanted to leave Trinidad and Tobago to go to America with their regular B visa, but they could not have gotten a return ticket, because remember, to get a return ticket you had to have shown that you got exemption and all of that, and that is where it was difficult. So now that the rules are going to be a little different, meaning from the 17th of July they're opening the borders and we should have travel back and forth into Trinidad and Tobago. That should not be a problem for you, but it's important for you to note that yes. Okay, so I am seeing Jesse saying yes, it can be done in Tobago at a cost. Jesse, would you mind if you have the information to say where it can be done in Tobago at a cost? Maxine is saying the WHO organization has included AstraZeneca as one of the vaccines listed along the other three mentioned above. So yes, the WHO has listed. So this is important to understand. The WHO has been approving vaccines, but the WHO cannot tell any country what they can do. So even though AstraZeneca, for example, is an approved WHO vaccine and Sinopharm is an approved WHO vaccine, the WHO cannot tell the United States that you must accept AstraZeneca or Sinopharm. The United States has to decide which vaccines it will accept. And for now, it is only accepting the American vaccines. Now, that's something you'll have to pay attention to, because you have to remember there is also a whole economic war going on in addition to this medical issue. China and the US have been butting heads for quite some time. I don't know when that is going to be lifted. I don't know when that is going to change. So we may see quite a while where the United States may not accept the Chinese vaccine. We don't know. We don't have control over that. But it's important, of course, that you get vaccinated no matter what vaccine you have, because they are all very good vaccines, and the vaccines are there to prevent you from getting infected. And if happenstance you get infected while after being vaccinated, it would prevent you from getting very sick, and it would prevent you from getting hospitalization and possibly even die. So it's important to note that, even though travel is something we all probably want to do, and we all probably don't want to have to go to America and have to quarantine for 7 whole days when we get to America, it is what it is. It's just part of the process. To be honest, plenty of we can afford to travel to go nowhere anyway. I know I can't. So at this point, it almost doesn't even matter what these other countries say. I can't afford to go nowhere anyway. So then it really does not matter to me right now. But if you are one who can travel and one who needs to travel, and you may also need to travel, for example, for school and so forth. And the rules are different, because if you're traveling for school, there's an expectation that you have a student visa, and the rules are different about that and so on. But you still need to follow the rules as you are traveling. All right. So that was United States. I want to then jump over to Canada. Because Canada has way more restrictions. They have way more limitations. Canada ain't playing. So let me show you what is happening by Canada. And again, I am using Canada's Government of Canada website. I can't remember what is their equivalent to the CDC. This is just the Government of Canada website. Yeah. As you see, big and bold, flights from India have been suspended. Full stop. So if you are in India or you're trying to travel from India, yeah, it ain't happening if you want to go to Canada. Full stop. Right? But we are not in India. Although when you see where our name is on another list, you would so as it says here, to protect Canadians from the outbreak, the Prime Minister announced travel restrictions to limit travel to Canada. So they still have their restrictions. Until further notice, most foreign nationals cannot travel to Canada, even if they have a valid visa, because they are also going through the same thing that we are going through. But it says here who can enter Canada. You can travel to and enter Canada if you are, of course, a Canadian citizen. If you have dual citizenship, and Canada is one of them that you have dual citizenship with. If you have a valid Canadian passport, or if you have special authorization, and special authorization means you can apply for special authorization if you have been issued a Canadian passport that is valid. If you have, excuse me, if you have not been issued a Canadian passport that is valid for travel, or you have a flight for Canada that is less than 10 days away, you have a valid passport from a visa exempt country. So you'll have to go through the list to see which country is visa exempt from Canada. I don't Trinidad and Tobago is. And if you are not a dual US Canada citizen. So again, you can apply for what is known as special authorization. But let me go back. You can also go into Canada if you have permanent residency in Canada. You can go into Canada if you are a person registered under the Canada's Indian Act. And you can go into Canada if you are a protected person. I honestly don't even know what that means. I guess I should have gone through Canadian legislation to see what they mean by protected person, but I I don't know. So if you're one of these people, you can't really go to Canada. Foreign nationals, including United States, can travel to Canada if they are eligible. So the foreign nationals who are eligible to travel to Canada, quarantine and testing exemptions for fully vaccinated travelers. So, starting July 5th, which was yesterday, day before yesterday, you may qualify for exemptions for some of the quarantine and testing requirements, but you must be fully vaccinated with an accepted vaccine and meet other conditions, including, what do they mean by accepted vaccine? Um, okay, before I go there, it speaks about exemption for fully vaccinated Canadians, which is what we are talking about. If you are eligible to enter Canada, which was a list above, you're a citizen and all of that. If you have no symptoms, asymptomatic, if you meet the government of Canada's fully vaccinated travelers requirements, which is what we would look at a little later, and if you meet all other entry requirements, you can get in. It's important to note, though, that if you are planning to travel to Canada, one of the requirements is that you have to put in your information into the Arrive Can platform. You have to go to Arrive Can and put in your information there. And depending on what information you put in, then it will spit out to you, yes, you can travel, or no, you can't travel. So don't run and take your fast self and go on and just buy a Canadian tickets to go and travel to Canada. Make sure that you put your information in Arrive Canada to make sure you fulfill all of their requirements for travel. Those who meet the requirements may be exempt. So if you meet all of the requirements above, you don't have to quarantine, you don't have to do a full stopover, and you don't have to do a 8-day test requirements. So how do you determine if you are fully vaccinated in Canada? You are fully vaccinated in Canada if you have, and by the way, you have to upload your proof of vaccination in the Arrive Can. So you still have to go to that. Even if you are fully vaccinated, you still have to go to that thing. You still have to go to that Arrive Can website, put in all your information, including uploading your vaccination proof, your proof of vaccination, before they even allow you. The vaccines that are accepted, here they are: Pfizer, Moderna, AstraZeneca, and Johnson & Johnson. Those are the ones that are accepted if you are for you to be classified as fully vaccinated. Pfizer, Moderna, AstraZeneca, and Johnson & Johnson. Canada is not recognizing Borat Tech, um, CanSino, Sinopharm, Sputnik, Sinovac, or any of the others. They are not accepting any of those others for you to be classified as fully vaccinated. Okay? So if you have taken one of these others, and by the way, if you're in Trinidad and Tobago, the only one of those that you may have taken would be the Sinopharm, then you would still have to go through the process, meaning if you are eligible to travel to Canada anyway, if you took Sinopharm and you are eligible to travel to Canada otherwise, meaning you're a citizen or you have dual citizenship or whatever, or you're approved to go to school or whatever, if you have Sinopharm, if you took Sinopharm, it means that you would then still have to go through the quarantine process, the testing process, and all of that. So it's not like you can't go, but if you go and if you are eligible to go and you took Sinopharm, you still have to go through that whole process for thing. You have to, there's a quarantine plan, which means you have to uh, have stay in quarantine for 14 days because that is a requirement there. If you are not if you are not fully vaccinated after the 14 days, then you kind of you have to work with whoever is the local authorities, and you are symptomatic or you don't meet other requirements, then of course you would have to then go on to get your medication and treatment and still be in isolation. You have to be tested on arrival, and you have to actually register in advance to save your test or to save a schedule for you to be tested. So you can't just show up and say, I want to get tested. No, you have to actually register in advance for you to be tested. And that is the process that you have to go through. If your test is negative, then you then follow whatever the public health measures are in the area you're going. Don't be in any close contact with anybody for 14 days. Keep copies of your proof of vaccination and so forth. If when you get there and you test positive, you then isolate yourself from others. You will be contacted by the local public health authority. You need to follow their instructions and, keep copies of those. Proof of vaccination as itself, if you don't provide the required information in ArriveCan before arriving at the border, you won't be considered for the exemption, even if you meet all of the requirements. So you have to go, you have to go to ArriveCan and put in all of that information. And the information you need to put in ArriveCan is the detail of your first dose, meaning the date, country, and the vaccine, the detail of your second dose, same thing, the date, country, whatever the vaccine is, proof, photo, or PDF file of the records of each dose, and so forth. So that is the information you need to put in there. Again, this is and I'll click on it. Hopefully it takes me to ArriveCan. Use ArriveCan. It's actually taking you to an app that you can use. It's a mobile app that you would have to use to put in all of your information to for them to determine whether you qualify to be fully exempted, or whether you need to be tested, whether you need to all of that stuff. Yeah. I wanted to show, where is that there? All of these are examples of people who may be who may be allowed to travel. If you're a family member of somebody who's a citizen, there's a whole long list. You just have to kind of go to the page. Maybe I could type the page in the chat so that you see what the website is. So I've just put it in there. That's the Canadian, all of the Canadian information there. Because it's a very long list of things that would allow you to travel or not travel, depending on whether you fit the criteria, whether you fit the different criteria that are there. It's a very long, extended list. Let's see here. All of that long list before you travel, you have to go to that kind of updates and so forth. So yes, this is what Canada says you have to do. That's what Canada says you have to do. So as you can see, it is like how Trinidad and Tobago had lockdown and they wasn't allowing anybody to come unless you get the exemption. Canada is still doing quite a bit of that exemption process and kind of thing. Well, not really the exemption process, but you have to meet certain criteria. Let me put it that way, because the difference is with Trinidad and Tobago, even if you were a citizen, you still had to go through the exemption process to get exempted to allow you to come in. Canada seems to not be doing the exemption process, but they're saying if you meet these requirements and you are fully vaccinated, then you would be able to come in. Then you would be able to come in. Let me just go to some of the comments. So Jesse is saying 950 by the old hospital facilitated. Okay. Thank you so much. So if you are in Tobago, you go up to the fort by the old hospital if you need to travel and you need to get that COVID-19 test 3 days before you travel. Thanks for that information, Jesse. Hi, thank you for joining. Cheryl is saying that the airline will give you the $800 to get your PCR test, and it can be done in Tobago for cost of $900 here. Yep. John Leacock is saying, come Canada now. Let me go Lime. Well, obviously, many of us wouldn't be able to. Cheryl is also saying it's by appointment only, and the test is only valid for 7. So it's only if you absolutely need to travel and you need to show that 3-day thing. You need to show that 3-day. Yes, Valerie. So the rule is no vaccine, no travel. But the thing though, this isn't a new rule. This is not a new rule at all. This isn't the new rule at all, because if you've traveled to other countries, for example, if you had to go to Tanzania, like when I went to Tanzania, I had to get a yellow fever vaccine. They will not allow you on the plane without your yellow fever vaccine. So having to vaccinate to travel is not a new concept. We are all now talking about it because of COVID, but having to do yellow fever vaccination is not new to travel. That's not new at all. Cheryl is saying, oh, you mean the 800 number, the 800 HEAL. So you call that number 800 HEAL, and then they walk you through the process. Thanks for the correction. Cheryl is also saying, be aware, folks, you have to have your immunization card stamped by the CMO office by the old health center in Scarborough. Yes, so that is true. Thank you for raising that. The regular immunization card that you get when you get your COVID-19 vaccine at the health centers is not proof of travel, is not proof of vaccination according to international standards. You would need a travel, I think they call it a travel vaccination card or something like that. And as Cheryl said, yes, to get that, you have to take the vaccination card that you got from the health center or Magdalena or wherever you got vaccinated, and go to the CMOH's office. That is Dr. Hoyt's office in the old Scarborough Health Center behind the Scarborough fire station, the fire station that burned down. The irony of that, eh? The irony of that. Yes. But that is you have to go there with your travel documents showing that you really are planning to travel soon, and then you can get that actual travel card. Yes. Thanks, Margarita. The number is 800 HEAL. So if you need to in Tobago, 800 HEAL, that is where you need to go. So again, if you need the information about the Canada's stuff, it's here for you to see whether you actually are eligible to travel to Canada at this time, whether you are eligible. And let me go jump quickly to the UK, Europe, that area. Let's see, where is that? Where is that? And this is gov.uk. Gov.uk, last updated the 30th of June is the last update. I haven't seen an update since then about this. UK has, so the thing about UK, about Europe, England specifically, let me be specific. England has very specific rules about traveling to England. And if you, if you've been hearing us talk, about the Tobago autonomy thing, talk about this book with these bills and so forth, you would hear myself or Assemblyman Farley talk a lot about the fact that even though there is England, and even though, there is the other territories, Wales, Scotland, and Northern Ireland, they make their own rules because they are autonomous outside of England. So what is in this thing here right now that I'm showing you, what is in this thing right now that I am showing you is pertaining to England. But there are different rules for Wales, Scotland, and Northern Ireland. And let me say quickly that that is kind of what we were hoping these autonomous bills would do for Tobago, where even though Trinidad and Tobago, Trinidad, with their 3 and 4 and 5 and 600 cases a day kind of story was going on in Trinidad, with the kind of autonomy that Tobago was hoping that we could get with these bills, we would be able to make our own different rules. So we wouldn't have to use the Trinidad rules per se. By the way, just so that you know, the way the bills are written now, that is not the case where if Tobago makes a rule, makes a law about something, let's say we make a law about COVID-19, and Trinidad comes and makes another law about COVID-19 that contradicts our law, because COVID-19 is classified as an emergency, the Trinidad law will trump the Tobago law. So we would then be forced to do whatever Trinidad is doing, even though that may not be applicable to what we want to do in Tobago. So I'm just throwing that in so that you see, even though we're having all of these conversations about autonomy and they seem to be very far removed from everyday life, they actually make a big difference, or could make a big difference with certain things. It's important to note that England has a red, amber, and green list. Red, amber, and green list. So countries that are on the red list, what to do if you have been in a country or territory on the red list in the last 10 days before you arrive to England. Basically, you have to, if you have been in a country or territory on the red list in the last 10 days, you will only be allowed to enter the UK if you are a British or Irish national, or you have residence rights in the UK, meaning you are, what the Americans would call permanent resident. I don't know what they call them in England, like a green card holder, basically, is what that is saying. I don't know what is the correct term in Britain and Northern Ireland. So if you've been in any of these red list countries in the last 10 days, then you can only go to the UK if you are a British or Irish national, or if you have the equivalent of a green card for the UK. And if you do, even if you are a British or Northern Irish citizen, you have to take a COVID-19 test. You have to actually book a quarantine hotel package, which includes 2 COVID-19 tests. So you have to actually stay at a specified quarantine hotel, basically, and pay your own costs. to stay at the quarantine hotel, and you have to complete what is known as a passenger locator form so that they could find you later on if anything happens. On arrival in England, meaning if you are on that, if you've been to any of those red list countries, on arrival, you have to get to your COVID quarantine hotel and you have to get your 2 COVID-19 tests. So let us see the list of countries that are on this red list of territories. Skipping down, skipping down, skipping down, skipping down, skipping down, so that we get to Badau, Trinidad, and Tobago. Trinidad and Tobago. So if you are from Trinidad and Tobago, or you've passed through Trinidad and Tobago, you are classified as having been to a red list country. And that means the only people who can travel to go in are people who are citizens of Northern Ireland and England, or if you have residential status. So you have what in essence is a green card. There is also an amber list. Amber list are countries that, you're kind of in between, is kind of managed. If you are in the amber list, then you can quarantine at home. That is the difference. You can quarantine at home for the 10 days, but you still have to do your COVID-19 testing and so forth, right? That is if you're on the amber list. And there are countries on the amber list, different countries throughout the world. Canada is on the amber list. Cuba is on the amber list. Let's see here. Mali is on the amber list, other countries, Norway and so forth. Wait. Well, look, St. Kitts and Nevis. St. Kitts and Nevis on the amber list. St. Lucia on the amber list. St. Martin on the amber list. St. Vincent and the Grenadines on the amber list. Well, yes. So that tells you, according to the UK, they are seen as managing their infection a little better than we are. So they are on the amber list. They are on the amber list. Yeah. So yes, they are on the amber list. And there is a green list of countries and territories. And if you are on the green list of countries and territories, you need to take a COVID-19 test. You need to book and pay for a day 2 COVID test. So they need you to take a test when you get there. You need to complete a passenger form on arrival. You need to take your test and so forth. And the countries that are on this list, Antigua and Barbuda are countries on the list. Barbados has been killing it with their COVID-19 management. Barbados has been killing it with their COVID-19 management. Dominica, COVID-19. Grenada, COVID-19. Killing it again with their COVID-19 management. So it's basically saying that if you are on the red, amber, or green list, what happens that would determine whether you can travel, and would determine if you are able to travel, what happens when you get to the country. As you see, Trinidad and Tobago on the red list. So unless you have a citizenship in one of those countries, or you have permanent residency in one of those countries, then you can't travel from Trinidad and Tobago. People in England who have had a full vaccine course, meaning 2 doses, can demonstrate their COVID-19 vaccination status for outward international travel. Other countries or territories determine their own border health rules, and they can't talk about that. Right, so let's see here. Those are just some. So the reality is, even if whether you've been vaccinated or not, whether you as long as you're on that red list, you can't do anything anyway. You can't do anything anyway. And as you see here, they have different rules, different things for if you're England versus if you're in Scotland, if you're in Wales, if you're in Northern Ireland, and so forth and so forth. So this, my point is, you really need to go to the different websites for these different places to see their options, to see where you fit, and so forth. Do you think Tobago could have been on the amber list? I actually think Tobago could have been on the amber list if we were allowed to be rated separate from Trinidad. I do think so. Because even though we have not, been perfectly great with our management, we have had smaller numbers of cases and that kind of thing. So yeah, I think we could have made it on the amber list. So let me just talk a little bit about what let me not talk. I want to share with you what the Prime Minister said. Let's see here. A couple of days ago about travel to Trinidad and Tobago. Let me know if you are hearing.
On about the 17th of, as of today, we're using the 17th of July. I would like at this stage to ask Dr. Parasram to go through the conditions for entry, since the CMO's office is the authority on what goes on in this matter. Lay out the conditions for entry through the port. And while Dr. Parasram is getting ready, I would say we have two international airports in this country, one in Trinidad, one in Tobago. Let me just say that to enter Trinidad and Tobago, there will be conditions laid down at Piarco, and there will be conditions laid down at A&R Robinson and Tobago. The difference is that in Tobago, we will not allow unvaccinated nationals to enter the country through Tobago. Unvaccinated nationals, if you are such, you will have to enter through Piarco. And if you are not a national, you will not enter at all as an unvaccinated person. So Dr. Parasram, can you take it from there, please?
Thank you, Honorable Prime Minister. So this is the reopening of the borders quarantine protocols for Trinidad and Tobago. So again, we go back to the definition, which is the cornerstone of vaccinated versus unvaccinated persons. Fully vaccinated individual is considered so 2 weeks after having or receiving the final recommended vaccine dose or doses of a WHO-approved vaccine. The approved vaccines to date from WHO are Pfizer-BioNTech, AstraZeneca Oxford, Janssen, which is the Johnson & Johnson, Moderna, Sinopharm of the Beijing plant, and Sinovac Coronavac. So the categories, passengers from all countries, we broke it into 3 categories. So you have the first category, unvaccinated individuals, and just a note there, this category applies to nationals only. You require a PCR test 72 hours prior to arrival, which will be validated by the airline. Immediately after arrival, you go into state supervised quarantine for 14 days, medical assessment within 24 hours of arrival, daily monitoring, and a COVID-19 PCR test done on the 7th day of your quarantine. Asymptomatic passengers who test negative are allowed to go home after the quarantine period, and passengers who test positive are immediately transferred into the parallel healthcare system based on the acuity of the disease at the point in time. Just to note, asymptomatic passengers testing negative on day 7 still have to complete the 14-day period within the designated facility. Retaining passengers requiring immediate medical attention, whether it be coming in by air ambulance or becoming critically ill while at the quarantine site, they will be allowed to go to any quarantine hospital where they get care. These are non-COVID positive, so they will go to possibly another facility, have their care. If it is less than the 14 days and you're well, you can go back to the facility thereafter. Stable patients being transferred back to the state supervised quarantine facility. Passengers who test positive for COVID-19 upon arrival or during quarantine are again transferred into a facility at the parallel healthcare system. Fully vaccinated passengers. PCR test 72 hours prior to arrival. Proof of vaccination, WHO approved vaccine. No quarantine required. Category 4, children. So unvaccinated children traveling with a vaccinated parent or guardian are allowed home with the following conditions: a PCR test 72 hours prior to arrival, repeat of the PCR test between days 3 and 5 of arriving into the country, which will be required to, that test is to be sent to the office of the county medical officers of health at the various counties. Of course, if you're positive at that time, you'll be isolated. Contact tracing will be started. Any unvaccinated adult traveling with a child will go to state supervised quarantine as per category 1. Unvaccinated children traveling without a vaccinated parent or guardian will also go to category 1, which is state supervised quarantine for the 14-day period. Prime Minister, that's the end of the presentation.
Thank you very much, Dr. Parasram. And
Okay, so as you see here, one, there is a difference between who can come into Trinidad and come into Tobago. It seems like the only people who can come directly to Tobago are vaccinated nationals, can only come directly to Tobago. If you are unvaccinated, and I listened to this and I was not sure whether you can be unvaccinated and a non-national. I did not get that clearly, and I've been trying to find if anyone else has it written somewhere. But it seems like the only place if you are coming to Tobago, you must be a national and you must be vaccinated. So that's the only option for Tobago. I remember that there was some hoopla, some bacchanal, something where somebody said that Tobago wasn't ready to start dealing with it. I don't know who said that. I don't know where they got that information from, because I see the Hotel Association saying them didn't say nothing like that. They don't know where that come from. They're ready and waiting. I see the Secretary with responsibility for health saying Tobago ready and waiting. So I really don't know who said Tobago not ready, but hey, who knows? But if you are unvaccinated, you can come through Trinidad. And then you have to go to the state quarantine. You also have to be, whether you're vaccinated or unvaccinated, you have to be tested the days before coming in. You have to show before you get on the plane. And that's how they're doing it. Before you even get on the plane, the airlines will not accept you on the plane if you have not shown that you are tested and negative. Full stop. You're not getting on the people and them plane. So you have to get your tests, whether you are vaccinated or not vaccinated. And if you are vaccinated and coming to Tobago, you can come directly to Tobago. I guess maybe like those flights that come directly from New York to Tobago on Sundays. Remember those flights? Maybe you could get a flight like that. But if you are not vaccinated, you have to go through Trinidad, do the state quarantining and quarantining and testing in Trinidad. And only after you've gone through your 14 days quarantine with no symptoms, no signs, and you test negative, will then be allowed you thing. Marianne is saying, if you are non-national and non-vaccinated, you will be denied entry. And my understanding is that that is what is happening. So they've only opened the borders for nationals, and they are allowing vaccinated nationals and non-vaccinated nationals, except that the non-vaccinated nationals would only be allowed to come through in Trinidad. Says, from what I've heard, a foreigner who has not been injected will absolutely not be allowed in Tobago. Yeah, that is what it is. So at least we now have an opportunity for our nationals who have been stuck outside of Trinidad and Tobago to come home. At least we have an opportunity for that. It means that they would have to come, and if they have not been vaccinated, they would have to get go to quarantine and get testing and that kind of thing. But again, as I said before, this idea of being vaccinated to travel is not a new thing. If you've traveled and you've been to any country that has an issue with yellow fever, is a perfect example. If you are going to Tanzania, if you're going to any other country that has an issue with yellow fever, you are not going to get onto any plane unless you prove to them that you have yellow fever vaccine. This was before COVID. This was 2018, 2017, 20, all kind of thing before COVID started. So this isn't a new thing. So my point is that being vaccinated to travel is not a new concept. It's not a new concept at all. If you did not want to be vaccinated, if you don't want to be vaccinated to travel, then you don't travel. It's as simple as that. If you don't want to get vaccinated, if you didn't want to get the yellow fever vaccine, then you know that you can't go a country that requires the yellow fever vaccine. It's as simple as that. Yes, you have the personal choice to not be vaccinated, but you know that you also have to deal with the consequences of that, which means you cannot get on a plane to go up to a country that is not vaccinated. And by the way, the same thing applies for school children, because we have been taking our babies at 3 months and 6 months. We have been taking our babies at 3 months and 6 months to go through to get vaccinated. And you have to carry your immunization card. You have to carry your immunization card to show that they have been vaccinated. So let me read a couple comments here. So a person living in Tobago returning home will not be allowed to quarantine on their home island. No, at least not for now. And this is why we need autonomy. The question about it is not the same. These injections are not FDA approved. Actually, they are FDA approved, but they have gotten emergency authorization, and it's not completely different. And let me explain really, really quickly for those of you who did not hear my description of what emergency authorization approval means versus complete approval. For drugs have to go through what is known as a clinical trial to get approval from the FDA, if it's in the United States, from the EMA, which is the European Medicines Agency, I think, in the UK, and so forth. And there are different entities like that in different areas. So Russia has their own, China has their own, and that kind of thing. You have to go through what is known as a clinical trial. And clinical trials have different phases. Phase 0 is usually the phase where the pharmaceutical companies are they're creating the chemical, they're creating the medicine, they're creating the tablet, they're creating the vaccine. So they're in the lab creating it, putting the chemicals together, doing whatever they're doing to get the vaccine or to get the medication. During phase 0, they may also test it on animals and so forth. Phase 1 of a clinical trial, is where they spend they test the medication, and in this case we're talking about a vaccine, on a small number of people, and it's usually no more than 50. It's usually between 30 people and 50 people in a phase 1 of the clinical trial. So they go in, they give it to you, they check to make sure that everything is fine, that it is actually doing what it should be doing. They check to make sure that it's not killing you, that it's not causing more harm than good, that if you have side effects, that the side effects are not horrible side effects and that kind of thing. So they only do it with between 30 to 50 people, right? And that takes a couple months to go through that process. After they've agreed that it is safe and that it is actually doing what it should do, then you move on to phase 2 of the clinical trials. Phase 2 of the clinical trials means that instead of just doing the test on the 30 to 50 people, they're actually doing the tests on hundreds of people. Again, testing to make sure that the medication is doing what it should do, testing to make sure that it's not causing harm, testing to make sure that, they've identified all of the side effects, testing to make sure that, all of these things are happening. And then only after the FDA or EMA or whoever has gone through the phase 2, and they realize that it is safe and it is actually doing what it says it should be doing and so forth, then it goes to phase 3 of the clinical trials. Phase 3 of clinical trials is where you expand it to thousands and thousands of people. And that is where you may have a group that is known as an experimental group, which is the group that actually gets the medicine, gets the vaccine. And you have a control group that is, the group that does not get the medicine, does not get the vaccine. And they look at those two groups and they follow them for some time to make sure that, the vaccine is doing what it should do, the medicine is doing what it should do. We are not learning of any new side effects or anything like that. That is too much of a concern or anything like that. Now, it is in phase 3. So you realize that for a drug or a vaccine had to have already gone through phase 1 and phase 2 fine before it can get to phase 3. And it is only in phase 3 where you now have thousands. You hear Pfizer, for example, talking about the fact that they did their phase 3 clinical trials on 30-something thousand people. Moderna is, same numbers, same thousands and thousands and tens of thousands of people who they've done their clinical trials on. Third phase clinical trials, phase 3 clinical trials. The difference with emergency authorization, the difference with emergency authorization is when they get to phase 3 and they get to kind of halfway through phase 3, couple months in, and they realize that the data that they were getting in phase 1 and phase 2 is replicating itself in phase 3, meaning the medication is doing what it should do, you're not getting unnecessary side effects, all of that stuff. When they realize that, what the FDA, and by the way, it has to be the FDA and the EMA in Europe and whatever is the Canadian version of that and so forth, they then say to the company, okay, we've been looking at your data. You can go ahead and start mass producing your medication or vaccine. You can go ahead and start mass producing so that when you actually get authorization, you have already started the mass production. You've already started the mass production. And kind of midway through it, they then go through the data again, make sure everything is fine, make sure that you're not getting any weird side effects, that you're not, that they actually is doing what it should do with these thousands and thousands of people following them for several months. Then they would give them emergency authorization, emergency use authorization. And emergency use authorization basically means that we have a situation on our hands where we recognize that if we do nothing, then we will have a lot of people dying, a lot of people getting sick, a lot of people doing that kind of stuff. But we have recognized that we have a medication, or we have a vaccine, or we have whatever, that it is working. And from the studies that we've seen so far, it is working, and we're not getting any real negative side effects or anything like that, that you can start using it. Even before you have gotten to the natural end of your phase 3 studies. So emergency use authorization means that they've only done a couple months of phase 3, and they have not waited until the end of phase 3 to then say, go ahead and use it, or go ahead and start mass production. Which is why in the United States, for example, when you saw that Pfizer got emergency use authorization, by the following day, Pfizer had vaccines to be distributed because they had gotten the emergency use authorization. Granted, it is a little bit before the normal natural end of phase 3. And they were allowed to start making the vaccines ahead of time. And they got emergency use authorization from the FDA to start distributing. And that is what is happening with all of the other thing. It's important to note that the phase 3 of all of these are continuing. And in some instances, they've actually started phase 4. And what phase 4 is when you've recognized that, you've gotten all of the data you were planning to get from phase 3, everyone is fine, it's doing what it says it should do, and so forth. Phase 4 means we now go and actually start doing research on special groups. So before you would recognize, they were saying that if you are a pregnant woman, then you should not get the vaccine because they did not do the test on pregnant women. or if you have certain diseases like HIV, you shouldn't take the vaccine just yet because they have not done the test. Or if you're a child under the age of 18, you should not take the vaccine yet because they haven't done the test on those subgroups. But in phase 4 is when they started doing the tests on those subgroups. And we've already gotten data. So there are vaccines in the United States, for example, where young children, not babies just yet, but children can get the vaccine because they've done the research with children, and the children seem to be, not having any major side effects or anything like that. And they seem to be benefiting from having the vaccine. And granted, vaccines are things that we use on children all the time. The measles, mumps, rubella vaccine, the whooping cough vaccine, the polio vaccine. The reason we have no polio right now in any, in Trinidad and Tobago, because we give polio vaccines to our babies when they go to clinic. So, it is what it is. It is what it is. Gypsy say, I consider myself to be well researched. Will argue with me. That's fine. It's not an argument. We're having a discussion. The beef is that the PM does not have the authority to block foreigners who are not being injected from coming into Tobago. There are foreigners who rent for months at a time in Tobago and may agree to the quarantine in order to continue on their month stay. Yeah, that's a considerable business, being denied the hotels, villas, guest houses, and so forth in Tobago. I agree. I agree with that. It is a thing. And by the way, these if you recognize that Barbados, for example, Barbados was only closed for a very, very short window. And Barbados actually had they were actually telling people, come to Barbados. Yes, we know in the middle of COVID, but we are going to give you a quarantine experience in our all-inclusive hotel. Come, yes, come. We are going to make sure you're safe. We're going to keep you in the hotel, confines of the hotel for the 14 days. But come, please come, please come. So Barbados was never really closed. You just have to test before you come in. And then when you get there, you have to test again. And then you have to go into quarantine and that kind of thing. It is what it is. Candice is saying which vaccines are tested on children or is being used on children. Pfizer is one of them that is now authorized. Let me check because the data is coming out so quickly. Because there's a difference in the age group. Let's see here. The age group that it seems that they're using for Pfizer right now is 12 and above. 12 and above is what they are using. And I envision that Moderna is probably the same. I'm now seeing there where it says Pfizer wants vaccine approval for 5 to 11, but that has not been granted yet. So it's just Pfizer right now, and it's age 12 and above. Age 12 and above. Yeah. So that's it. Oh, I'm also seeing that Moderna has also been approved for age 12 and above for children, 12 to 17. So there are a couple that are being used on Moderna. Yeah. So yeah, Barbados's entire management has been very, very clever. Yeah, I personally think that Mia is my girl, and I kind of want to just pack up my Georgia bundle and move to Barbados, to be honest. Barbados has been killing it, and I really just want to pack up my Georgia bundle and move to Barbados solely because of Madam Mia Motley. She is killing it with the management of COVID. She's killing it generally with management of the country, but with COVID specifically. So anyway, that's it, guys. Thank you all so much for tuning in. If you have any other questions that you would like me to address, let me know. I will do another live if possible. We could do any topic, and it doesn't have to be COVID related. It could be other issues. I think I want to do another live on these Tobago autonomy bills so that people could actually get a sense of what's happening in them and what is missing in them and what we want amended in them, because there are a couple key things that need to be amended. I think I'll do a live about that sometime soon so that we could talk through that and get a sense of what's happening there, and we go from there. So guys, again, thank you so much. It has been an honor. I'm seeing Gypsy is saying yes, girl power. That WHO is saying no to the children from an international epidemiologist. Yeah, okay, I'll definitely do some more research on that. Thanks. I'll go looking for that. Thanks, you are a supporter. I know, and I appreciate that. And we have to keep fighting. Cheryl, please, we need to know a whole lot. Oh gosh. Oh my goodness. No. I am only joking when I say I pack up my Georgia bundle and leave. I'm way too excited about the prospects of Tobago. Trisha is thank you, Magnus. Ah, my pleasure. So guys, thank you all so much. Thank you so much. Again, if you have not already, please share this live with somebody else who might be interested in learning about it. As we can see, there are so many different rules. So it's not just that, you can't go to Canada or you can't go to England or whatever. You have to see what the categories are and so forth. And at least for Trinidad and Tobago, starting the 17th of July, I hope they didn't change it today at their press conference, because honestly, I didn't even watch today. I hope they didn't change that date. We would at least be able to allow our nationals to come back into the country, whether you're vaccinated or not vaccinated. At least our nationals could come home, and that's important. That's really important. All right, guys. So thank you so much. Thank you so very much for tuning in. Again, share the live. Ensure that you stay safe. Wash your hands. Wear your mask. Ensure that you stay a distance from people. Follow the curfew regulations and so forth. Too many people still getting arrested and charged for breaching curfew and all of that. All right, guys. So again, thank you all so much. Thank you, and have a blessed day.